Hey all, so this is looking at D3.1 again, which is HL content. This is about pregnancy, and we're looking at pages 686 to 691. If you have a female body, you might find this information useful, so it might be worth watching, but you don't have to if you're not HL. So the purpose here is explaining the process of fertilization, fetal growth, and parturition is the giving birth process. So in fertilization, we've already talked about this a little bit in the SL content, but sperm can detect chemicals released by the egg. And so they're swimming towards the egg. And once the sperm reaches the egg, it's going to bind to specific glycoproteins in the zona pellucida, release digestive enzymes from the acrosome, and it's going to allow the tail to push the sperm inside the egg. The nucleus of the sperm, once in, activates the egg, and the egg will go through an extra round of meiosis, and it will also send a message send the cortical granules via exocytosis to the surface of the membrane, and that's going to harden the zona pellucida, preventing more sperm from getting in. And so here you can see fertilization has occurred here inside the fallopian tube, and then as that ball of cell grows, it's going to move down the fallopian tube. So once fertilized, DNA is going to replicate and then join and start going through mitosis. So this is growing the ball of cells that is going to become the fetus. And so initially fertilization occurs, a zygote forms. This whole process is going on for about 30 hours. Many rounds of mitosis are happening quickly because the egg is big and it doesn't need time to make more organelles. So about day 2 to 5, it's a solid ball of cells. That's a morula. And then day 7, it's a hollow ball of cells due to unequal cell division and cell migration. It's moved from the to the endometrium from the fallopian tube for implantation, and so that it can start to access food resources. And this hard zona pellucida is going to start to break down. The outer layer of this ball of cells, the blastocyst, is going to become a placenta, and the inner tissue is going to start growing. And at 8 weeks, it will be considered a fetus. Prior to 8 weeks, it is an embryo. So fetal growth and pregnancy tests. So HCG is a hormone produced by the blastocyst, and the embryo triggers the corpus luteum of the ovary to continue producing estrogen and progesterone to keep the endometrium thick. So the new ball of cells is attached to the endometrium. It's getting its nutrition from the blood vessels in the endometrium. And so it needs the endometrium to remain thick. This process here with HCG and the blastocyst is going to take about 10 weeks while the placenta is starting to grow. And once the placenta gets big enough, it's going to start secreting its own progesterone in response to the HCG signal. HCG stands for human chorionic gonadotropin. But this transition from progesterone secretion from the corpus luteum to the placenta can cause a miscarriage when the switchover happens. And so this is around 10 to 12 weeks. And this is typically why women wait until about month 3 to tell people that they are pregnant, because it's not uncommon. About 1 in 4 women have a miscarriage in the first 3 months of their pregnancies. And so obviously telling someone that you are pregnant and then having to tell people as a follow-up that you had a miscarriage, which is could be a very emotional thing for a woman, can be very difficult. So HCG is detected in pregnancy tests, and it binds to antibodies in the test, triggering a color change. So if you had HCG present in your urine as a female, it would bind to these monoclonal antibodies, and the monoclonal antibodies would bind to the test dye site, and that would cause a positive test site. And in random fun factoid, if a male were to pee on a pregnancy test and it came back positive, that actually might be indicative that they had testicular cancer. So babies' placentas are created from fetal tissue. So the baby is growing its own placenta And the placenta's purpose, this is a picture of a placenta here, and the umbilical cord that connects to the fetus. It's allowing the exchange of nutrients such as glucose, oxygen, and antibodies from the mom and waste from the baby. So the baby's cells are using oxygen and producing carbon dioxide, but it doesn't have functional lungs yet. And additionally, its liver is breaking down proteins, which will make urea, but it cannot pee. And obviously, a mother would not want its baby peeing into its amniotic sac, filling up this entire bag with urine. Ooh. So the baby's tissue is also going to create the amniotic sac. That's the bag that it's in with amniotic fluid. And this is for protecting the fetus, typically from shocks and impacts. So if a mom, for example, fell at some point, then the fetus would be protected because it would be in a bag of liquid. It's kind of like a baby airbag. The mom and the baby's blood never mix. The fetus produces chemicals that prompts the mom's immune system not to attack the placenta. And so the mom's immune system is a little bit reduced here so that it's not attacking the placenta. Otherwise, the mom would view the placenta as an invader. It's not her cells. And so that's the purpose of the immune system. The baby at mom's blood can never intermix because the baby might not be the same blood type as the mom, and that would potentially kill the mom as well as the baby. And so there's a lot of villi in the placenta, allowing high surface area to volume ratio for diffusion through the blood vessels. And so here you can see different blood vessels. So that's the umbilical cord there. And so we have this area with high villi and the blood vessels of the mom. So that's going to be diffusing out of the blood in and then picked up and moved into the baby's blood. So we have diffusion, facilitated diffusion, osmosis, and endocytosis happening in this process. And interestingly, placental mammals, so that have placentas, are different than other mammals like monotremes or marsupials. Marsupials give birth to a very, very tiny baby, and then it lives inside their pouch. So they don't have a placenta, but they are mammals. They do feed their babies with milk, and they do have hair. And monotremes are very, very rare these days. So it would be like the platypus. The platypus feeds its babies with milk, and they do have hair, like fur, but they lay eggs. So that's why platypuses are also just super weird. And we all know that. So the fetal vein is going to carry blood to the baby, and the artery to the placenta. So remember, arteries carry blood away from the heart. So the baby's heart is beating the blood away to the placenta to pick up nutrients and drop off waste. And then the vein is carrying blood back into the heart, and that's going to have oxygen and glucose present. So parturition, this is the birthing process. So near the end of pregnancy, hormones are released by the fetus to signal the placenta to stop secreting progesterone. So the baby is saying, I'm ready to be born, stop with the progesterone. This allows the mother's body to start producing oxytocin from the posterior pituitary gland, and oxytocin causes uterine contraction. So oxytocin is also the love hormone. So the mom's body gets flooded with oxytocin in this uterine contraction process when giving birth to the baby, and also allows for intense feelings of love and bonding to happen with the fetus as it is born and now is a baby. So more contractions cause more signaling for oxytocin. This is a positive feedback loop. More oxytocin, more contractions, more oxytocin, more contractions, until finally the baby comes out and we have a new equilibrium, which is where once there were two humans, one human with a fetus inside, now there are two. And so the mother in this process, the cervix is going to dilate, open up, and the amniotic sac that the baby is in because of the squeezing on the sac is going to burst. And this is sometimes referred to as water breaking, but isn't like a puddle on the floor like you might see in movies. And then the baby comes out head down, face backwards. So women, as they approach their 40s, their estrogen levels and progesterone levels drop because their ovaries stop working. And so over time, they're going to go towards menopause. This process in the 40s can start causing symptoms of perimenopause, and they can continue for 5 to 8 years, where hormone fluctuations are just kind of all over the place. It's like being in puberty, but backwards. And menopause typically happens around 50 years of age on average for most women, and that's most women of all racial backgrounds. So symptoms of the perimenopause situation can be headaches, joint pain. More than about 60% of women have joint pain in their fingers and toes or in their knees, can relate to the problem sleeping, problems remembering things, dry skin, loss of sexual drive. And all of these are just related to hormone levels. And so there are solutions to this: healthy eating, reducing alcohol and caffeine, no smoking, exercise. Exercise can really help with, in some cases, some women complain of hot flushes where their body feels just really overwhelmingly hot. So exercising can really help combat that. And then hormone replacement therapy. So it used to be, up until a couple of years ago, actually, that some studies suggested that older women that were using HRT had health complications related to breast cancer and cardiovascular heart disease. But that has since been overturned, and the Women's Gynecological Association has indicated that hormone replacement therapy is a safe way of treating all of these symptoms. Additionally, another symptom in here is very commonly depression, as well as extremely increasing anxiety. And if you already had mental health issues, they can be exacerbated, made worse in this time frame. So HRT can really, really help with that. And it has been shown that it is not linked to increasing cardiovascular disease, and it is not linked to breast cancer, but it will reduce heart disease. It will increase life expectancy, prevent strokes, prevent bone breakage, as well as treat depression and all these other symptoms. So talking to a gynecologist about that when you get into your 40s, and if you're experiencing these symptoms, would be really important. So to summarize, sperm joined to the zona pellucida, the cortical granules prevent polyspermy. HCG from the embryo causes more progesterone and estrogen to keep the endometrium thick, which can be detected in pregnancy tests. The placenta exchanges nutrients and produces estrogen and progesterone. And then birthing, oxytocin causes uterine contractions when progesterone levels drop, and that's a positive feedback loop. And HRT can be useful for women experiencing symptoms of perimenopause, and then also into their menopause time. All right, that's it for this video. Thank you for watching, and I will see you in the next one.